There you go. Ooh. Ooh, it's tough to get in on that right side. But these are the things right here, and it's kind of crazy. Like the last 3 people that came in, they all think they have like this, like a wear and tear or like arthritis going on in their joints. Man, these are just chronic tendinous injuries. If somebody can work out the tendons, see, watch this now. Tight, tight, tight. Yeah. Loose, loose, loose. That's you know, the difference between jogging 3 days a week in comfort versus this, I can't go running, my body's breaking down. You were in Kroger yesterday, and you bent down to pick up like a bottle of water, and your whole back seized up.
Yes, so like the lower part of my back, like the waistline, I feel like a strong minute of like electricity, and it just my back went numb. I think it was last 6 weeks I've been sitting down a lot on a couch, so my posture hasn't been as, and I haven't seen a chiropractor for months.
Okay.
And plus I've been running a lot since the gym is closed now, so I've been running,
Yeah.
and I haven't been stretching out properly, so I think that's good.
Yeah. And does it hurt worse or get achy from sitting, or does it actually hurt worse when you go running, and then you come home from the run as you're, you know?
I think both.
Yeah.
Like as I'm sitting down after maybe 45 minutes, my back feels like it's crumbling, like it's like I start sweating. Like that doesn't even make sense. Like it hurts here, and then and I go for a run. I get back, and it's or like man, it hurts twice as much, and then
at the end of the run.
At the end of the like when I pull down.
Okay.
And then I have to stretch out a little bit. I have a roller.
Okay.
I take a hot shower and then I turn it up, and then at the last 45 seconds, I put cold water. So it helps me a little bit. But yeah, but yesterday it was like, I need to go see Joe.
If this pain happens, does it shoot down your leg at all?
No, not yet. Hopefully not. It was just the lower back. But it was weird. It was like a weird sensation. I never had before.
And you've never had surgery on anything like that? No. Any injury you could think of recently that might have made this flare up outside of the picking up the water?
Well, I think the only difference that's happened now that I've been, like I said, I've been sitting down a lot, and I don't have an office, so so it's sitting on the couch, and my posture's like this, and typing a lot. I think that's the only difference I can think of. But beyond that, I don't know.
And are there any other pains in your back and/or extremities, your neck, anything else that you feel along with this?
I do feel like my calves, especially my right one,
Okay.
they're like, you see, they're like more stiff.
Okay.
But that's the only thing I could see, and that sometimes tightens my Achilles, and then from that, my glutes, I can feel it sometimes. But I just started running again. I haven't been running for like a year. So since the gym closed, I've been back at it.
Yeah, I feel it.
Trying to get some freaking burn some calories, dude. My quarantine line's catching up to me.
It's interesting though. You say like especially the right calf is cramping up. You have like some right glute pain, and when you pointed to when you bent over, it was like indicating the right side. So it sounds like potentially swollen disc. You know, something that's agitated. Kind of that right side is definitely something to pay attention to.
Okay.
So what are your goals here today? Is it?
Just if he could maybe address, probably get readjusted, adjusted back. Yeah. And then maybe you just give me some protocols for safety, like hey, do this, do that, or do this before you work out. Just something basic that I could.
I'm glad you said that too, because I was actually going to say I'll show you some stretches that will actually help minimize the chance of you actually hurting that back again moving forward, and like a kind of a protocol for after your workout or during your workout, because I never say to stretch before, but stretches after. That'll definitely help.
Definitely, yeah, and I need to get better at that for 100%. Like I don't stretch properly.
Okay. So we'll get a good assessment of the actual quality of motion, and we're going to pinpoint where exactly that nerve pressure is coming from, because that's what's causing all this is nerve. Chiropractic is maintenance, right? It's
Yeah, definitely.
keeping your spine aligned, keeping your spine healthy all the time, because every nerve that innervates every organ, muscle, and gland in our body is hiding behind here. And you can see right in here, you got some edema, right in here. So edema swelling, right?
Yeah.
So here's the lower back, these lumbar vertebra, and then right in here, this like L5 and sacrum area, it's got some swelling, more on the right, as indicative of the injury. There's some swelling on the left too. So right here where I keep passing by the scope, we're getting a nice break down here at like T12L1. Thoracolumbar junction is very common because that's a big, it's a shifting point where the biomechanics in the spine change when you're bending. And then we have that nice break right here at L5S1 on that right side.
Okay.
So that's where we're gonna focus a lot here, and then we're gonna come back up here and see what kind of tension's up there.
Okay.
So go ahead and bend forward like you're gonna touch your toes all the way down, and come on up. Ooh, baby. You feel the tension coming back up?
Yeah.
And this is riding really high here on the right. Yeah. Just like this. Stuck ASIN. This thing is not moving at all. And if we go ahead and do this side, even with the thumb.
Oh, it's like more flexible, but it still hurts. Yeah.
Which one's worse, like when you feel my thumb go right through the joint? Is it right here where I am?
That one right there, yeah.
Or, come on back a little, right there. The first one, right?
Yeah, the first one right there, yeah.
So this is altering everything else here on the spine. We're gonna get right into it. All right, so we're gonna do a pull push, we call this. So you're gonna feel my hand just kind of get in here like this.
Yeah.
And I'm gonna torque down this way. I'm gonna use my other hand up here.
Okay.
You're gonna feel my leg on you like this.
Okay.
You okay?
Yeah.
So just let everything relax. Some people say to breathe, but not me. Good, that's a piece. And now let shoulder drop back.
Okay.
There it is.
Oh, yeah, I feel great. Oh.
All right. Use this hand
Yeah.
to push up on the table here, and push yourself on up. And walk that off back and forth a couple of times.
Yeah.
That's pretty good.
Oh, it feels great. I feel like it popped like the lower side of my back. Is it close to the tailbone or?
Yeah. Does it feel a little looser right now?
Yeah, feels good.
Good. I'm actually going to do this. I'm going to have you go on this table.
Okay.
And then what I'm going to do is I'm going to ice you down, because now we created like an instant inflammatory process. We got a good release out of the joint.
Okay.
So what I'm going to do is I'm going to ice this second spot, because believe it or not, just the way it's going to feel with me working on it up there is going to be a little more tender. And then I'm going to adjust that mid-back.
Now, how often do you recommend?
Well, I think it depends on, whatever condition you have. So, I mean, I like to see people in the beginning just kind of getting adjusted every week.
Okay.
I mean, unless you're really, if you're really hurt, I mean, if things are bad, you have to kind of come in every other day, every day for 3 days, then tinker down to like once a week, whatever. But ideally, like once a week, once every other week, I think that people will really do well, especially when they're carrying a lot of stress or an old injury. Chin up a little bit more. There you go. Nice breath in, and all the way out. Let that shoulders all relax down. There it is. Nice. So let's make this adjustment here. And now let it come over to the right, and let it fall into my right hand. Let it back up a little. Let your head relax and drop that right arm off of the lap right there. Let it go. There you go. Ooh. Whew. It's tough to get in on that right side.
Oh. Dude. That's great.
All right, let's walk that off a few times. See how your back feels right now. And we want 100% honesty here.
That's great. I feel like you, man.
Yeah?
Yeah.
Good. So I'm going to adjust those feet too. once I
Good.
adjust those.
Yeah, that's great.
You ever had your feet adjusted before?
Never.
What's wrong with some of these chiropractors out there not adjusting feet? You hang in there, and we'll get you to be part of the club.
Oh, never. I'm looking forward to it though.
Guys, 3 out of 4 people, have you ever had your feet adjusted before? They say nope. Nice breath in, and all the way out, and let it go. Oh.
You know, whatever you did to my Achilles, it feels so good.
Yeah, oh man, you needed it.
Oh.
We had to get rid of it. You had some chronic adhesions. I mean, no wonder you've been dealing with that stuff. How'd that feel?
Oh, it feels great. It can't like it popped like my left hip or somewhere. I felt over here and it went down.
Oh, that means I have to do more internal rotation and finish the job in here. So, look to your right. Yeah. There it is. That's the rest of it. Woo, baby. He's like jello. He's a new man. Here, come on, let me help you out.
Oh, dude, this is great. Thank you.
Of course.
Oh, that's good.
Feel like you got pillows on your feet now, right?
Yeah, but like lighter.
They're really different. Yeah. Nice.
Yeah. We're good?
Yeah, man. I think we're good.
I just want to give a big thanks to Dr. Pearlman for adjusting me today. My back feels great, my waistline and my calves, they were so sore. So thank you, Dr. Pearlman, I really appreciate it. I think this is the beginning of a great new start of my health.
When you came in, what level of pain were you in your low back?
I would say about a 7
Wow.
on my lower back,
Okay.
6.5, 7.
And how do you feel now?
Like 2.5, maybe 2.
Nice.
Yeah.
Yeah. Awesome start. Well,
Yeah.
thank you, and we appreciate it.
Thank you, appreciate you.